Good afternoon for those who've joined us so far. We'll be getting started in just about 1 or 2 minutes from now. Thank you. Good afternoon, everyone, and welcome to the Quality Center PSO members, and again, our other PSO partners across the country. Thanks for joining us for part 2 of our webinar series that we've entitled Engineering Patient Safety Using Best Practices from High Reliability Organizations. Before we get started, I'd like to introduce our speakers for today and also go over just a few logistics. So presenting for us today, we have Allison Amos, who is a clinical assistant professor at the UNC Chapel Hill Radiation Oncology Department and the UNC School of Medicine, and is also a member of the department's Division of Healthcare Engineering. We're also pleased to have Chris Ralia, who is the president and founder of Communify Health. All lines are currently muted and in listen-only mode. During the Q&A session towards the end of the presentation, you'll have the ability to ask questions or make comments. You can do that 2 different ways. One, you can raise your hand, and if you're called in over the line or over voice over IP, we can unmute your line and you can ask your question live. You can also chat in questions using the chat question pane in the control panel, and we'll address those questions towards the end of the presentation. If you are speaking over the line, please do introduce yourself and the organization you represent before speaking. The session is being recorded, and we'll make the slides and recording available to all attendees shortly after the conclusion of the presentation. And then finally, there is a short evaluation that will pop up at the end of the session, and you should also receive that via email. We do ask that you answer those few questions and give us feedback, not only about today's presentation, but also about future webinar topics that we can provide to you. So at this time, it's my pleasure to turn over the presentation to Allison.
Hi, good afternoon. Thank you for the intro. Can everybody hear me okay and see my slides?
Yes.
Yes, we hear you fine.
Great. Great. Well, thank you guys for joining us for part 2 of Engineering Patient Safety using best practices from high reliability organizations. This is a continuation of last week's webinar where we had Dr. Lucas Mazur kind of giving us some a look into the concepts that we have brought from UNC and the use of the technology, of how that supports those efforts. So what Chris and I are going to share with you guys today are main focus is on 2 main stories, how we take those concepts in practice and apply them using the technology that helps us support those efforts. I'm going to start with the first story. I'm going to hand it over to Chris after that, who will take us through the second story and a handful of closing slides. So we're going to start today with Alice. Alice is a member of her department's Quality and Safety Committee. One of her roles on that committee is a Good Catch champion. And through her story, we're going to follow the process of a report or an incident or a good catch being submitted, and taking a look at how she interfaces with her group and her program to investigate, analyze, and follow up on that, and how the use of this technology helps her and aids her in doing that. I'm going to start by just giving a little bit more information about a quality and safety committee. That may or may not be a term that folks are familiar with. Really, the goal of a committee like this is a multidisciplinary group who meets routinely to review some of these things coming in. So these we're reporting and learning. We're asking for input and feedback from our frontline staff or our managers or our leaders. How is our process working? Can we identify some things that are pain points or that are concerns that aren't working well? Near misses, actual misses. We want to collect that information, and the role of this committee is to help routinely review, analyze, investigate, and then kind of determine some plans, what we want to do with those that come in, and then close the loop with those submitters or the folks that have been involved. So I'm going to talk about Alice and her role on the committee, her role as a champion, kind of within that framework. And I'll talk about a couple of additional roles as we go through as well. So how does something like this start? So we, through lean concepts and systems thinking, we encourage people, empower people to take a role in the process that they work in every day. What works well with it? Where are some opportunities where we can improve? Where are some pain points? Handoffs, communication, kind of any of that. It's really in this kind of sphere of safety mindfulness, which Dr. Mazur talked about last week, systems thinking. So, for example, we've got Mary and Jeff who, during a meeting with a patient, are discussing their prior history, and the patient's wife reminds her husband about a medication. Now, Mary, who's thinking carefully about this, doesn't recall seeing that medication listed in the chart. So she makes a note afterwards to confirm whether or not that's on that patient's record. She may go back to Vicki or administrative. She may go take a look at the chart and confirm that, in fact, that medication wasn't listed in the chart. They want to correct that record, and then maybe they'll submit a good catch. And we use the term good catch to encompass a pretty wide net of things. So that you may be familiar with that term. That means something slightly different. We like to cast a pretty wide net. We want anything that could have or did result in a delay or harm or rework, and we really encourage that wide net, not just to capture a pretty wide gamut of things, but also to help develop and sustain that culture. The input, the feedback that we're getting, we want people to feel safe to speak up about any of those pieces. And so we can submit that online through this technology. You may have another technology that you use to submit those through. But we want to capture that information and route it to the appropriate folks who can help look into it, who can help then determine what to do with that. So Mary and Vicki are going to submit that. We can do that through a user or through a team. So you can submit as an individual, or if you're working as part of a team, or you could submit that anonymously. So you can pick the group that you want to submit that to, give a description of what happened, and then click submit. And that's going to get routed to the committee. We can do this via computer or a link embedded in one of your other applications. We can do this via phone, and a number of different ways to submit that. And once that's submitted, we want to then collect some more information. So we've got a description of what happened, and we may need to ask some other people to chime in on and add some context. So maybe Mary and Vicki go back and ask the patient to try to understand, is there a reason why they didn't include that medication on the form? And maybe the patient says, I couldn't remember the name of the drug. There's not really a place on the form to add comments. I forgot to mention it when you guys came in. There could be a number of reasons why that didn't match. Luckily, his wife remembered and they were able to talk about it. But that was some context they wanted to go back to the patient or to the source or where it happened to get some additional context and then add that into the software. I'm going to go through one more slide, and then I'm going to move over to a live demo so we can talk a little bit more about what's shown on this screen. There's a lot of opportunity to collect information on different fields or what's important to you, what sort of information do you want to collect and manage, and we'll talk about that in just a second. So let's come back to Alice just for a second. So Mary and Vicki have submitted a good catch. They've added some context, and that's going to get assigned to a champion. Alice, in this case, is our champion, and the champion's role is really who has the subject matter expertise to champion the investigation of that. So our committees are generally comprised of multiple folks. We try to have a representative from each team. So if you're at a unit level or a local level, we try to have representation from all the disciplines. If you're maybe at a hospital level or a more centralized level, maybe you want to have representation from all the divisions or all of the service lines. But somebody who really has that contextual information that can help investigate, has the content knowledge, and can help engage with folks in that area to learn more or to implement a change. So Alice is going to start looking at what else can I learn about this incident and the process behind it. So maybe we're looking at how frequently this problem happens. Maybe we're looking at where in our process this is occurring. Maybe they need to talk with several other folks and then give their input. So what does this look like in our software? So this is a test version. So a lot of this is dummy data. What I wanted to show you here is if we look at if we submit a good catch here, what it does is it comes into a list view. This is how our committee manages the incoming reports. So we're going to give it an ID as it gets submitted. We'll display the description, who submitted it, who our champion is, what sort of status is this in. All of our new ones come in unreviewed, and then the committee can manage how open or active or closed as they go through their workflow. And then we can sort and filter our list view based on this as well. We maybe have severity or date and time. We can customize the different columns depending on what you want to show up. And then we can filter this data by a number of different things as well. This really gives you a really multifaceted way to collect and display that information. So everyone that comes into this list view. And then when we're ready to look at it, we can click on this ID and it's going to open the edit view. So this is an example of the edit view, similar to what we see here. So as we're doing some of that investigation, we're collecting that information, the context, we're talking to a number of people. We want to come in and put the information in the report here. We can capture that in a number of different ways. One of the things I'll say up front is this template may look very similar or very different from what you might need. All of this is customizable, and so if you have certain fields or certain templates that you're used to, or hey, this is way too much information, or this is not enough, all of that you can build and tailor to fit your workflow and your process, your committee. So all the submission information comes in here. We've got some attributes that we can assign. So if we want to look at some potential root causes or some tags, some ways to kind of trend and collect the data and the information, we have fields for that. Here's our champion view. So if Alice gets assigned as a champion, that's going to email trigger or email her saying, hey, you got assigned as a good catch. Can you come and take a look at it? We also can add reviewers. So these are folks that maybe aren't a champion. They can't be accountable to the investigation or the follow-up, but they might have some really good context to add, and we want to kind of bring them into the conversation. And so that's what we would use the reviewer field for. And we can capture notes and countermeasures. And really what I wanted to highlight here is this idea of a care path. This is a really powerful part of the analysis for us. A care path is essentially a part or whole of your process. So if we look at just kind of these stages here, this is a pretty fundamental set for radiation therapy as an example. So we might have some pre-visit, our patient comes in and gets assessed, we do some imaging, we plan the treatment, we do some review and verification, we deliver the treatment, and then we might have some on-treatment management, and then the patient eventually will complete that treatment and go on to their next thing. And so with each individual incident that we report, we want to identify where are the places in the process where something happened. So we use a couple of points to do that. We use a tripped point, so where did this generate? And a caught point, where did we catch this? And then, sorry, my mouse is moving a little on its own. And we can flag where that was tripped and where that was caught. And then what are those barriers or those steps in between that could have caught this and didn't? Lucas talked a good bit about kind of safeguards, looking at Swiss cheese model. How can we identify the controls that we have in place and evaluate how well that they're working? And this is a big way that we do that. And so if we can do this for each individual incident, it's going to generate this little graph at the top. It's going to tell us kind of where we tripped, where we caught, and then what are the barriers that are in place in between that maybe could have caught this and didn't. And this is really powerful information for a single event right here, but you can imagine stacking these on top of each other and getting some really good information about how your process as a whole is working. So are there places where we've got a theme of things that are being tripped in this one step or this one stage? You really can start to kind of evaluate your process as a whole overall. And this is much of the work that both qualitatively and quantitatively, both anecdotally and visually, we're really getting our committees to get engaged in this as well, to look at that process as a whole. So I showed you a couple of fields from this view. As Alice is assigned as a champion, she's really starting to investigate all that information and then can document that as part of her role as a champion. She's going to go and talk to some other folks, and maybe some folks are skeptical. Is there a problem with the form? Seems kind of clear to them. But if we take a look at an individual and then stack them on top of each other and look at this collection as a whole, we can really start to see where there are patterns that are coming in. What are there specific pain points in that process? It's a really great way to visualize that. And then we can connect that to an improvement project. So if we want to, we find that we have a number of things, trends or a collection of things that we've identified an area for improvement, we can connect it directly to a project. More story. One of the other things that is really beneficial with the technology support is that it supports multiple software at once, even in the same form. So there can be multiple or outside of it who can be in this good catch, and they can just be in different fields. So the efficiency and the productivity of what can happen at that meeting or outside of that meeting is really leveraged and supported by technology. So we will, in Chapel Hill, with the group that Lucas was describing last week, we'll go through anywhere from 5 new ones to 20 new ones every week. This group meets for about an hour every week on Wednesday mornings, and they take a look at we met 2 days ago or yesterday, we met yesterday and we reviewed 17 new ones. And so we really can get the information in, so folks on the committee can get that information in really effectively to make decisions. We look at the discussion that's there, and we can make decisions based on that. And that really helps the momentum, the cadence, for looking at each of those pieces. The last thing I'll touch on around this story. So one of the hardest things in sustaining this culture is the feedback, making sure that we're closing the loop with the folks that are engaging in this system. If we're asking our frontline folks to come in and give their input and give their ideas, it's really critical that they get some of that feedback. And so we want to make sure that our committee is supported in doing that and can leverage technology to help do that as well. So Alice is going to go in, update the software with her notes, with her discussion. She can close that. She can tag other reviewers if she needs to trigger people. And then we want to close the loop with Mary and Vicki, who submitted that. We want to recognize their efforts, and we can do that through a number of ways, electronic high fives or good news boards. We have a monthly QA meeting where we take the highlights of the committee's meetings over that month, and we present them to the whole department. And as part of that meeting, we recognize folks who have submitted good catches. We recognize some really potentially severe things, an award for that. We recognize those efforts. We recognize the efforts of self-reports as well. One of the hardest things in that culture is not only to say, hey, I made a mistake, but up for everybody to see as well. And that's how we learn. That's how we engage in that process. And so we want to make sure that we're speaking to the folks who are self-reporting as well. Mary and Vicki, some feedback, kind of analyze our process. We're getting a lot of information coming in. We're tracking and trending it, consolidating it. We might have identified several pieces of improvements, and we might want to start an improvement project. Maybe as in this story, we want to improve that form. Hey, if we made a couple changes to that form, would that patient, the patient to say, hey, I'm on some other kind of drug, but I don't remember what it is. So if we can make an improvement there and we're getting some information from those folks for improvement. This system and this program, kind of implementing these concepts using this technology, really helps kind of provide that real-time awareness of that system. But you can clearly link those to other priorities. You've got real-time data at multiple levels. So we talked a lot about kind of at this team level, even at an individual level beyond that, what are these efforts kind of rolling up into a department level and then beyond. And what that really has helped us in our managers, they don't have to rely on monthly reports or a report coming from somebody who's not in-house to the department, summaries of change efforts. We really can get this real-time information. And this has been really helpful for us as a group, the ability to have multiple people in, the ease of use has really helped make for very productive, much more effective and efficient conversations when that committee meets. And we're not only engaging our frontline folks to submit these ideas or submit the concerns or submit these misses, but also to take part in adding context, submitting ideas for improvement, and really getting them engaged outside of the committee meeting as well. So I'm going to pause here and we'll switch over to Chris for presenters. So Dean, if you could help us with that. And I'm happy to answer any questions on my part towards the end of the presentation.
Thank you, Allison. So this is Chris Relier. Can you see my screen? Is my screen presenting? Dean?
Yes.
All right. Okay. So as Allison mentioned, she just took you through one of the event analysis components, but the platform itself is much larger than that. And what it's really designed to do is provide the infrastructure that UNC as a system can use for not just event analysis, but figuring out, okay, what does that tell us? What do some of these often weak signals tell us about our processes? So when Allison was talking, for example, about the care path graphs, a lot of the time when we're looking at these events, one of the key things to understand is that these are not necessarily events that would normally be meeting the threshold of a risk management level of concern. A lot of these events are small delays, small amounts of rework, but they're affecting the processes of these frontline teams. And one of the critical components about being able to get all of these distributed frontline teams involved is that you're letting them approach aspects of their own workflow that are connected with larger strategic priorities, but that are affecting them on a day-to-day level. And so we're going to talk about a story here, get this going, of a frontline project. So that is connected, to strategic initiatives around patient satisfaction, around, increasing efficiency. But again, it's very much focused on what is this team's workflow like, what are their challenges, and making sure that this team is empowered to control their own workflows. So in this case, Mary is a nurse manager. She's got a strategic initiative around streamlining her own workflows. And this, in a lot of cases, these teams have had experiences before where they've run into different types of challenges, such as communicating across department lines or being able to maintain and sustain a change, especially after a project or a strategic initiative ends. So we're going to talk about how both the team operates during the process and then how the infrastructure helps them communicate and maintain these changes. So during the pre-planning step, one of the things we try and make very clear is when we're creating a lot of this information visibility, we want to make sure that teams can see how the work that they're doing connects with these strategic priorities and make sure that their leadership is aware of how these connections operate. So what are the strategic initiatives? What are their goals? And then what are the resources and what are the mentoring and coaching resources that are available? So one of the aspects of improvement flow that is a little less visible in, for example, the screens that Allison was showing you, is that there's a training management platform built into this. Now, this is not designed to compete with compliance or continuing education-oriented training. This is designed very specifically around process improvement and being able to connect things to specific change management projects or the type of activity that people are going to need for this task. So Mary has realized, okay, I'm bringing on a team. Not everybody's seen this type of training. So we're going to load up a specific type of program. I can kind of build and mix and match a program from a lot of the lessons that we have, or you can add your own videos, you can add your own resources, and then she can assign that out to her team and make sure that her team has had the preparation in advance of the project. So the next step is understanding, okay, given this situation, what's our baseline? What are we looking at for targets? So her team is going to start tracking some of the key metrics to understand what's going on at the moment. And then when they're looking at that and understanding, okay, what are some of the system-wide goals that we're targeting? They're going to be setting goals for this project. So what do we think we can accomplish in 1, 3, maybe 6 months? So here they're going to start to fill out an A3 improvement project. Now, one of the components of the system is that UNC uses lean-based methodology. So an A3 is kind of the standard template that they've got for this type of work. But when we're looking at this type of system, this is something where you can design, similar to the event analysis side, you can design different types of templates for different project sizes, different project scales, and make sure that this is something that fits with your system. So I'm going to jump over into some of the screens a little bit. So as Allison mentioned, there is a similar to the types of screens that you have for event analysis. You can see all of the different projects going on across the organization. So whether you're looking for certain types of tags, certain types of topics or initiatives, you can look and sort by where different things are happening, what's going on in the building I'm in, what's going on in my type of department. We want to make sure that there's a lot of visibility on these types of efforts so that you can see what's going on. Just to jump over quickly into the training side, again, you've got the ability to see, if you're planning a project, you can see, okay, I've assigned out a couple different topics, what's been happening with my community, who's actually gone through the training and where they are. one of the key things we're looking at doing when we're talking about distributed efforts is making sure that there aren't any bottlenecks for frontline teams that are doing this type of work. We don't want people getting discouraged, and we don't want people getting stuck. So someone like Allison, who serves as a process improvement coach in radiation oncology, can monitor her communities and see where people, how far they've progressed and if they're getting stuck anywhere. But going on to our projects, when we're looking at this A3 template, we're starting off and saying, okay, what's the project we're looking to do? What's some summary data? What are some of the metrics we're looking to track? What types of events might be representative of this kind of problem? So these are linking back to the type of events that Allison walked us through before that can serve as stories that highlight where things might be going off track in terms of our processes. What are some of the tags and the teams involved? And who are the team members? A critical component of this is, in a lot of cases, organizations do have strategic initiative teams that are coming in from something of a top-down perspective. One of the things we want to allow organizations to do with this, and at UNC this is something that's been very successful, is be able to distribute this work out and create frontline work groups that are able to tackle a lot of this work themselves. In Lucas's previous presentation, he mentioned that just within cancer care, they've got 150 improvement projects that have been led by more than 70 different people. So instead of just saying, okay, this is something we're going to talk about, one of the follow-ups to all the events that Allison was talking about, and there are thousands of them just within cancer care alone at UNC, is the ability to say, okay, now we've realized there's an issue and we're going to act on it. So this project template serves as kind of the focal point, both for the planning and all of the resources and activity that go on in this project. So this is a standard A3 template. Again, starting off just in terms of concept, what's the reason for action? Then we're going to start modeling our current state. What's the target state that we want to have? And how does that connect to a number of metrics that we can measure to see if we're having a real impact? Why do we think some of these issues are happening? And then we can start getting into what are some solutions. Think of these as kind of small experiments, small changes that you can make to see, okay, if we do these things, how are they going to impact our project? And then you can start breaking that down into tasks, assigning those tasks out. And as you're starting to do all this work, whether you're modeling this in terms of something like a Visio diagram, whether you're modeling this on a wall board, we want to be able to capture all of the information for this type of work, so that this type of work, you can make this available not just to your team, but you can start making this type of information available to teams that connect with the team that's doing this work. And so in this sample, being able to see what's going on in the planning stage alerted a neighboring team that there was a miscommunication about some of the handoffs that were going on. And they were able to have a couple different meetings, sort out and clarify what goes on, and make sure the different teams understood how those handoffs were supposed to happen, and then use that to improve both their plan and the team's understanding of what's happening in their workflows. Then we get into the issue of metrics tracking once we've started these projects. So a large component of this platform is that you can connect your system, metrics that you're connecting to manually, as well as if you've got enterprise analytics teams, you can feed in different types of metrics to be able to monitor what's happening. You can annotate those metrics, just load up a metric view. So you can see in a metric detail view, what's the history of our edits? Are there certain types of annotations, certain type of events where we want to say, okay, there was a change here that was going to weigh on this. We can see our goals. We can see any types of control borders where if we get outside that boundary, we want to understand it. But critically, we can see what are the different projects that are acting on these metrics. So when we're talking about that system-wide visibility, you can go from different, each point, you can say, okay, at this metric or at the strategic initiative, what's going on across the entire system to drive change on this topic? And so here we can see that, one of our key metrics is improving, another one is not. And this is, again, one of the critical components of real-time data visibility. Because in a lot of these cases, if someone's doing this on an Excel sheet that's hidden in SharePoint somewhere, you may hear about how that project went at the end of 90 days, but you don't have the ability to say, okay, how is this going in an easy kind of lightweight review way, and be able to intervene on these projects where you're saying, okay, this isn't working for this team. Can we come in, get them some help, get them some support, and be able to get certain types of projects back on track? So in this case, the team was able to bring in some coaching. They were able to get the patient satisfaction numbers where they wanted them. And now the team is able to say, okay, we've over this 3-month period, we've been able to get, streamline the patient volume and make sure people don't feel that they're being rushed. So we've been able to get the operational impact, but at the same time, patient satisfaction is up. And we've also been able to increase team integration and reduce staff overtime for this project. So as we mentioned in terms of the metric side, it makes it very easy to say, okay, that project has ended, but we still want to be able to monitor and understand what's happening, as time goes forward. And you may want to be able to come back and revisit those projects. So we have a system called improvement cycles, where you can basically say, okay, we've done this project, we may want to continue with it, and you can reload that or share it with other teams and make it very, very easy to learn from what's been done. So at this point, what we're saying is we have a successful project. How do we propagate that through the system? And instead of saying we just have summary data, when we're looking at this type of work, we're saying, okay, we know who to contact. Anyone in the organization can see what happened. They can see the results. They can see the work product and the different types of things that the team created. And they know who to contact for more information about it so that they can learn how to do it themselves. So that ends that story. And we want to talk a little bit now about a couple of the higher level or system level components that are very much part of Allison and Lucas's concern, and very much something we're trying to support with the platform itself. So in this area, when we're looking at quality improvement programs, we're looking at issues of project sustainability. A lot of these programs have been operating for years, and how do you keep that type of enthusiasm, especially after some of, possibly the low-hanging fruit projects have been taken out? How do you enhance these programs, especially around the issue of scaling across sites, departments, and teams? One of the things that Allison didn't have a chance to show you in the Good Catch story is there are a lot of tools for handling cross-department or cross-team workflows and being able to identify where things go wrong at the handoff points. Another key component of this, especially with the improvement project side, is dealing with turnover. In a lot of cases, organizations spend a ton of time and money training key leaders, and then once those leaders left, they bring a lot of that expertise with them. What we want to make sure is that organizations are able to develop and progressively develop leadership in a very distributed way across their organization so that those team leaders can become, progressively more sophisticated and larger scale leaders across the system. As we mentioned, there are a lot of different roles in process improvement. One of the key, we've at the high level, we've got our administrators, we've got groups like risk management, but then you're also getting into groups that contain, are responsible for quality improvement, process improvement, and other specialties across the system as a whole. We need to make sure that everybody, whether you're a senior administrator or a coaching group, whether you're a department leader or a frontline team member, that you have the tools you need to understand how your work connects to the whole and what is the right next step for you at each part of that process. So now I want to talk a little bit about how this connects to some of the different quality improvement groups at UNC. And this is actually something where Allison can take over because she drives a lot of this work across the system.
Sure. Thanks, Chris. So this is kind of a layout of how the different groups at UNC are kind of strategically prioritized and how kind of they're thinking about quality improvement and how they look at kind of the approach or driving. Are they kind of coaching focused? Are they training? And the infrastructure that supports kind of that going through. So our lean training group is really kind of looking at strategy and coaching support. How do we kind of build and deploy capabilities to teach people these concepts, and then build leaders throughout the system that can then help frontline folks or folks who are new to those concepts and help be leaders, local leaders in those areas. We've got several strategic improvement groups. So they're looking at kind of working with our leaders and our executive leaders on setting the strategy for the system or for the entity or for a service line. And they're really interested in that kind of higher level approach. How are we connecting all of this improvement work? How are we setting the vision and the strategy to then propagate this work through those groups? We've got frontline driven improvements, which is really kind of the bread and butter of what our team does, where we're really focusing on developing that culture of safety, reporting and learning, identifying improvements we can make in our daily lives, and then sharing that with other folks, other like groups like us, sharing those kind of up through centrally through committees or different leadership change. That's kind of a frontline driven improvement. And then in terms of analytics and reporting, they're looking at this from a strategic point of view as well. And what's really exciting about this is that this technology and the concept, Chris mentioned UNC is a lean-based organization, and that we can drive these concepts at each of those levels. We can bring folks in very specific to the work that they do and what where they're interested in going, but also link that and connect that with other groups who are applying the same concepts, but it maybe have a slightly different focus. And so this is part of the program that our team has developed through those processes and systems for that frontline driven QI, but with scalable infrastructure for that, and that we can use this technology to support each of those levels, bring them in, it meets you where you are, and then what is really valuable is that it connects each of those groups together, not only our coaching groups, but our risk management group, our analytics groups, and then connects that to different levels of the organization as well, from our strategic planning and our executive leadership to our frontline teams. So just a little bit of final context here. So this infrastructure, this program really started in a single department. That's what Lucas spoke about last week as our radiation oncology group at Chapel Hill. And then over the course of the next year or two, our group supported that program being implemented in many oncology locations. 17 locations in oncology. And then since then have looked at how do we support this in, as DHE has grown and our scope has grown, how do we support this in our outpatient level clinics, which is our 160 locations at our main medical center. But we're looking at that scalability and then planning for a system level infrastructure as well, where we're engaging those system level quality groups. We're looking at that strategic planning, but still being able to connect that down to the work that we're doing with our frontline teams.
So the last bit is, again, we haven't had, in the scope of this webinar, we don't have the ability to talk about all the different aspects of this type of work. But the platform is really designed to be able to capture everything that's going on across the system, wherever anyone's doing work on process improvement. And make that available, visible, and shown within a context so that people can understand, okay, how does this relate again to the whole? How does this relate to all the different efforts? And this is something, and we don't have the time to show you all the different parts now, but we want you to get a sense of what are some of the different components we're looking to bring together. Because a lot of the time these systems exist in some type of isolated way, but this is something where we want to make all of this available on one platform to the entire system. There are a number of, customizability components, integration components, and a lot of questions along that we can talk about with questions. This is something that's been designed for systems like UNC that have tens of thousands of employees and a lot of different organizational complexity. But the key idea is that from a user perspective, wherever you are in the organization. It's easy for you to use, it fits with your systems, and it lets you do the work you need to do. So we're about to open it up for questions, but one of the key comments with this is if you've seen something that piques your interest and you're interested in learning about this more, for your own organization, please contact me. And then we're also interested in understanding if organizations are interested in doing the types of collaborative work that UNC is currently doing with groups like Dana-Farber in Michigan, if they're interested in, say, taking certain types of strategic initiatives or certain types of strategic projects and working on them in a group format. So if you're interested in something like that, please email Lucas or Dean at NCHA. And now we can open it up for questions.
Great, thanks Chris and Allison. So this is a good time just to remind folks that if you have questions, you can chat those into the questions pane. I see a few coming in now, this is great. But also if you are dialed in, you can raise your hand, we can unmute your line. And so I'll just make a few quick comments and we'll address the questions. We're here at NCHA and through our PSO and the foundation, we're excited and pleased to have UNC kind of share their story. We're always looking for kind of new and innovative approaches to addressing quality and safety, and we think this is a great example of a new innovative approach, and we're always talking about sustainability, across projects. So we're happy to bring this to you, but we also want to explore these opportunities too. Is this something, as we find innovation, we can kind of scale and spread to other organizations, and how can we kind of help support that? I know a lot of organizations is talking through our quality programs, talk about the importance of a strong safety culture, and other organizations have set up good catch programs. So it's good to hear UNC and kind of reinforce those concepts. But it just the importance of kind of meeting organizations where they are. So it's great to hear when there are innovative solutions that are kind of customizable based on kind of where an organization is in their kind of maturity and improvement journey. So let me just, let's see, I see one quick question coming in here. Let me see if I can open this up. So give me 1 second here. There's a question asked, and Allison and Chris, I don't know if you can see this, but also I was going to read it. Do you also track employee injuries / improvement related projects through this software?
We don't. We have a separate system for employee incidents. But so the tracking and trending is done there, but what we can do, what we use improvement flow for is really to look at that. What do we need to know? Maybe not about a specific incident, but about the process itself, maybe around that incident, or are we seeing a collection of employee incidents in a piece of the process or part of that, and we can extract that information out, we can extract appropriate information out, and then do our deep dive, do our process improvement in improvement flow, and then we can always pull that summary out and attach it to our occupational health department is who manages those forms.
There's one component to that. We mentioned that this integrates, connects with some of the risk management systems. This, for example, does not replace the risk management system used in UNC. So when we're looking at some of the specialty systems that are used in the system across UNC, one of the key things that we focus on is the ability to easily get data in and out of those systems. So we're often looking just at the process-oriented components. If you were to compare us to a system that's more on certain types of compliance or certain types of injury or claims management, we use a slightly different data set. So we want to be able to easily get the relevant data in and out of our systems so that we can coordinate with those groups. We're not trying to replace the specialty functions that some of those groups perform, if that makes things a little clearer.
Great, thanks for addressing that. And I do see a hand up, and I'm going to try to unmute this line. If the name is Purnima Nanoscore, so I'm going to try to unmute your line so you can ask your question, assuming that you were wanting to ask a question live. And so you're unmuted now. Purnima, can you hear us? And if you were intending to ask a question and you can't speak, feel free to chat that in. Okay, and she's saying they're sending these via chat. So let's give it a second for this to come in. Another question came in. Can this pull in any cost / financial data to show effectiveness or value to the bottom line for some of the QI projects?
Yes, so that is not something that's necessarily in the default templates because there are multiple different return on investment methods for that. But when we talk about the templates and the customizability, you can create there are a couple of different types of return on investment modeling, both for cost and return, and you can create those and connect those into your templates. So that's something that can be integrated and customized for however your department scores that.
Okay, just give a pause for a minute. Are there any other questions folks have for our presenters today? One of our attendees said they were sending some questions via chat, so I'll just kind of give it a second for those to come in. One question I thought about while we're waiting for a few more to come in is we talk a lot about in some safety and quality and safety initiatives, the importance of executive rounding, and I was just curious if this is a tool that's helpful for executives and helping facilitate their rounding on units.
Chris, I'll take a stab at this, and you're welcome to chime in. We haven't used this for our executive rounding at this point, but from at a departmental level for rounding, I would say yes, absolutely. The ease of which we can get into that, get into the system, find the information that we need to then use for that rounding or to help keep track of that. The dashboard visualizations that we could, print and post on a whiteboard or put on an electronic monitor at those rounding stations. If we have the information in there, we can easily get it out, display it, and then our rounding leaders. So we have something in radiation oncology. We do safety rounds, and we will get input and information from folks who say, hey, I've got something's broken, or I'd like to do a safety rounds on my area. And those, our departmental leadership will then round in that area, talk to the folks there, how's it working, what's broken, or what do you need, do you have any concerns? And we do capture that and track that in our system, in improvement flow. And not only can the leaders get that information ahead of time, so they can do some prep for that, but then after that, we can keep track of the improvements or the changes that we're making, the feedback that we got, and then get those updates out to the submitters as well.
Great, thank you. Another question has come in asking about, asking if this is kind of like a parallel system with risk management reporting. Just asking are the same events reported in both kind of this system, improvement flow, and also risk management system?
Sure, that's a great question. No, we use our hospital event reporting system will drive all of our submissions. And we have collaborated with our risk management group for the last year and a half or so to really align those efforts. There are a number of kind of homegrown and duplicative systems that had been operating that we didn't have a good alignment and collaborative relationship with all of those groups. And that's something that our team has been working on for a number of years to help kind of better align those efforts. And so we use our hospital event reporting system to submit all of our events. And then we have a relationship with our risk management group that looks at, okay, which of these are the ones that you're really interested in seeing? So those events, those adverse events or sentinel events, the events that you're going to manage claims on. We have our risk management takes the lead on looking into those, analyzing those, often with the same groups, the same committees, the same people in that area, and they'll take the lead on making sure all of that is done in compliance with our regulatory bodies. And then all of our process-oriented pieces, or maybe our near misses or our safety concerns, those are kicked over to improvement flow, to our committees, to do those deep dives, to do those kind of process-oriented analyses. And those are done without our protected, with no PHI that comes over. And then we will document in our hospital reporting system what was done. We can take a snapshot or a printout from improvement flow if we've done a deep dive or if we did an improvement project on it, and attach that back in the hospital reporting system. So they really are, through the relationship building with risk management, we really have built an aligned process that really has these two softwares are complementary rather than duplicative.
Great. And then one more question's come in. It says, when multiple people are allowed to be in the same event, and make updates, how does the system deal with conflicting inputs? Yes,
Sure.
no fields, for example.
Sure. So in that field, in that situation, what you're doing is you actually, if you've got multiple people in a given event, it'll show certain fields get locked in real time. So you can see the changes reflected in real time, so you can see where people are working, and certain fields will, if somebody's actively entering information in one, that individual field will lock while that's happening. Now, in some fields like notes, you can basically create parallel notes in real time. But if you've got a situation, again, where you were talking about like a yes, no, or certain types of binary conditions, in that case, again, you've got some fields that will lock and some fields that will let you, for example, create two notes in parallel. Everything is, tracked, versioned, and time-stamped, so you can see like when the different notes came in and who did them. But again, we want to make sure that you can have 3 or 4 people doing this type of data entry, because again, what Allison mentioned is a lot of these events, you're getting very good, very thorough analysis in just a couple of minutes. And so we want to be able to, delegate that work out, but we also want to make sure that people aren't, overwriting each other's changes. So that's where the locking comes in. And that's at a field level.
Okay. I'm not seeing any further questions, so I'll just ask one more time because we're getting close to the top of the hour. If you have any kind of final questions, please go ahead and chat those in. And, I'll just, as we're kind of seeing if there's any final questions, kind of wrap up here. And just, again, take the time to thank both Allison and Chris for that wonderful presentation, and also Lucas, who kind of teed it up and kind of gave the history in the beginning, how this all work came about at UNC. As Chris alluded to, and you can see on the final slide here, if you want to kind of know more about the improvement flow platform, you're welcome to reach out to Chris directly, and his contact information is there. Through NCHA and our PSO, we're exploring, is there an opportunity to kind of convene a group of hospitals as part of like a pilot learning community to kind of work together, and how is this, again, something we kind of spread across multiple organizations. We're interested in exploring that if there is interest on your end. So I would say, please contact myself, my email there, dhiggins@ncha.org, and we can assess the interest. And if there's enough interest, a good next step would be to maybe pull together a group to kind of talk through what that could look like. So instead of just putting together and asking, so we would look for a group to help us, again, co-design that and work on it together within a piloted learning community. And then there's one more email address, I think it was logistical in nature. Yeah, I was just asking what email address will the recording and slides come from. So again, for all the attendees, you'll receive the recording and slides from me. This is Dean Higgins at dhiggins@ncha.org. Again, the email address is up there on the final slide. Chris and Allison, we're at the top of the hour, 3 o'clock. Any closing comments before we wrap up?
No, just thank you all very much for your time.
Yes, thank you.
Great. Again, thank you, and thanks for everyone for attending. This wraps up our webinar, and thanks for joining, and you may now disconnect. Thank you.